start. And we are very thankful to all the present journalists because we have a very important topic, the public procurement reform. And we have a lot of people who work on the issue how to change public procurement, and that's why we have brought together all the experts at this table and the officials from the Ministry of Healthcare. And I'm very grateful to you because the procurement in healthcare actually means life for the patients, and this year is the year of transformation, and we experience all the shortcomings of the past period and the loopholes of the transition period, and that's why we have the shortages in vaccines, in medicines, etc. Today, we will try to show how we could reform this sphere in order to feel the results next year. With this, I give the floor to Olga Bogomolets, Member of Parliament and Chairwoman of the Parliamentary Committee on Healthcare. Good morning, dear friends. The public procurement is the best, could be the best loophole for the corruptioners, and nobody would abstain from corruption in this sphere voluntarily. Of course, in this sphere, we have developed in this sphere a sort of enclave, which a sort of group of people who systemically robbed patients, putting in their pockets public funds which were allocated for medicines. Of course, those people, those corrupt people, never thought about moral values, destroying Ukrainian producers of medicines and buying minimal stock of medicines from national producers. And in the Ministry of Health and among activists, we still have some people who try to change situation for the better. During the last year, the Ministry of Health did no steps to change the situation in public procurement. All my requests to the Minister of Health to forward to the Ministry of the Interior all the materials about wrong procurement procedures and about corrupt cases in this sphere were never done. Moreover, we have doubts about correct public procurement of, for example, insulins. When the ministry spends currency buying insulins in Lithuania, etc. This year, the ministry has 6 billion hryvnia for public procurement, and in case this year procurement of medicines would be done along with the old procedure, there is a possibility that a part of those procurement will be done via international healthcare organizations, while biggest part of them follow standard procedure, which includes that corrupt schemes which I mentioned before. And in this case, I can say that those people who sacrificed their lives in Maidan, in the front line, they gave their lives in vain, because there are no changes in corrupt schemes in the Ministry of Healthcare. I'm very grateful to volunteers who represent the civil organizations like Patients of Ukraine, that they continuously express their disagreement with this corrupt scheme and try to change the situation for the better. I am absolutely ready to support civic initiatives of the Patients of Ukraine NGO and some other organizations. Unfortunately, this is not the Ministry of Healthcare which initiated the changes and the initiative which we are discussing today. But these are NGOs, and I am ready to do everything possible to substitute finally, to ruin the corrupt schemes in the Ministry of Healthcare and to change it for the better one. And in this context, I would like to mention that unfortunately we have not passed, we failed to pass the standards of treatment, the protocols for treatment. Without standard clinic protocols, we would never change the situation with corruption. We need to pass these standards for treatment. We need to pass the procedure for public procurement. Otherwise, these schemes of theft would continue.
Good morning. It makes no sense to repeat again the importance of public procurement for the Ministry of Public Health Protection. For me personally, this is an issue of honor to prove that the Ministry of Public Health Protection is capable of something, particularly whenever it is responsible for it. I cannot but mention first steps in the area of public procurement. Surely it is not enough. More is needed. But still, we saw certain progresses this year, with hopes it will continue next year. The meeting we have today and the materials we are going to see today, they will surely be of use to complete the picture, to see better what needs to be improved or changed in order to have an efficiently performing system based on evidential data. This is by far not the first attempt to reform the public procurement scheme within the ministry. First of them were made by the European Commission and WHO and the World Bank back in 2008, and some of these recommendations remain highly valid until today. And any further suggestions will be gladly received by the Ministry for the sake of moving further. We have a draft order of the Ministry to establish a work group to reform the system of public procurement within the Ministry. It will comprise experts. The membership will be done according to open lists in order to prepare some real stuff for change in line with new norms, new regulations, and it will cover the whole aspect of planning, procurement, execution of procurement, storage considerations, etc. As you know, this May, the process was launched to establish the list of vitally necessary medicines according to Mosul list. And this will allow us simplifying the building of medicine nomenclatures. Ideally, it should make a unique and only document about public procurement of medicines. We don't have anything like that up to this moment, and it should include both medicine and pharmaceutical forms and treatment protocols, etc. And we will move further in this direction also with the assistance of our international partners. Clinical protocols, there have been directives issued by the ministry to establish such protocols as per national procurement programs. There is another ministerial order to better manage the stock of medicines and to provide for real stock taking of medicines available on site. It will include establishment of an entirely innovative electronic stock taking instrument. And this shows that the Ministry of Public Health Protection does have certain vision of necessary changes, and we hope that it will seriously affect the whole system of public procurement within the Ministry of Public Health Protection. Together with our key international programs, we're thinking about implementing new projects to be implemented already starting this month. A contract was signed by the European Commission with 2 international consultants who will come out to Ukraine to also work in the area of public procurement. Particularly, this area will be covered by an international expert with previous experience of work on that in EU country. And our colleagues from SIAPS will contribute to launching an entirely new system to monitor supply chain management matters. We also have experts working with us who we worked with within the scope of the UNDP program, also in the scope of competitive tendering procedures, public procurement and related matters, and there are some tangible changes of that already palpably notably present. And this shows we are making certain progress. Besides, we have experts from a technical assistance group. We've been working closely with them, and we do our best to involve all potential and possible partners in that. And let us be mindful of the fact that it may not be possible to change rights everything within less than 1 year. Still, I think that we've made some substantial progress. And so take the number of claims lodged with the Anti-Monopoly Committee on tendering procedures and public procurement procedures. It is a clear indication of certain moves in the area. To wrap it up, I can tell you that the information you're going to hear today will be definitely useful to better shape a coordinated strategy of public procurement system within the healthcare area, and it will be further strengthened with our international expert community, and we have all necessary preconditions to spur further our efforts in order to shape correct principles of the national medicine procurement system. And we do hope that already beginning next year, these principles will be used for medicine procurement within the scope of national programs. It is about 4.98 billion for the next year. And we have the figure of today at a range of 1.8 billion. The situation we see in Ukraine today as regards poliovirus and related vaccination, unfortunately, it was also foreseeable. Nevertheless, it is controlled, and there are procedures of managing the situation. Still, it is rather an exception than the rule. And it definitely says of the need of better planning, better procurement. It is about routine governmental practices to be in place to mitigate such outbreaks as polio outbreak in the Transcarpathian region. It is not just about corruption, it is also about the rights of citizens, of nationals, to healthcare services, and this is an immediate responsibility of the ministry. Surely there are corruption risks, they are among the priorities to tackle, and better transparency in the field will provide for better outcomes. Thank you, Igor. Maybe right after this presentation, the time will be right for comments. I'd like to comment on the situation with polio outbreak. There are two categories responsible for that. First of all, the Ministry of Public Health Protection, because of insufficient vaccination of children and insufficient number of vaccines. And this is a multi-year situation. And then we have another culprit, the media, who really pumped the situation, telling everyone how lethal it is. And it leads to the situation that even half of children of MPs have never been inoculated because of fears of vaccine. And it is the task for the media now to explain people that the problem will be without inoculation, not with it. And it might ultimately lead to the closure of our borders with other countries. They in the EU have resolved the problem time and time ago. They're not going to see more polio infections in their region. And that was one of the topics of yesterday's meeting of the Committee on Public Health Protection. Vitaliy, as you are in control of the printed version of the concept, maybe it's time for you to say something. Thank you for calling me a controlling officer. Well, polio is one thing, but I could tell you more about BCG vaccine and their availability in the central clinics in Kiev. But, well, I can tell you that everything spoken about the ministry is also something to be said about me, myself. Okay, Igor, then I will tell you that the current composition of the ministry is incapable of furthering the reform. Until the ministry is covered by and working under the umbrella of biggest Ukrainian pharmaceutical companies, we will never see any reforms here. And the situation where the transfer of medicine procurement to international associations and organizations is the best solution in this case. It is good when professional organizations together with CSOs come up with an idea of reform, a concept of reform. It surely means that the ministry will be compelled to move, and there are high hopes that at least some of these reform steps will eventually happen under the pressure, continuous pressure on the ministry. If this reimbursement scheme will be finally implemented, it will be a huge leap ahead, but I'm strongly skeptic about that, because the guys in the ministry chaired by Mr. Zagoria, they will never cut the branch on which they're sitting. They did their best to kill the very idea of transferring public procurement to international bidders, and I can tell quite openly that the only idea I believe in today is in our capacity to force the ministry to transfer medicine procurement to international bidders. And then, after this first step, let them spend years reforming themselves. We have 15 years of international experts' presence in Ukraine. We have no problem with devising a vision, a strategy, a concept of reform. And because of that, it doesn't make any difference whether we are going to have 3, 5 or more international experts sent here on this ground. The key problem is about political will to do something. Otherwise, we will eventually end with another infographics in the portfolio of next coming minister. This presentation includes information that volunteer organization may use to force the minister to do something. And I would really recommend remitting our first step to this reimbursement procedure developed and presented in this document. Well, it's entirely normal to have these arrows of criticism against the ministry, but on the other hand, these are commonplace problems all around the world. It is not a situation unique for Ukraine, so I would still want you to go to the key point of today's presentation. I think Dmytro Sherembei can come up with presentations, on-screen presentation regarding this.
And afterwards, we will launch total procurement, public procurement inside the state. Because after 2 years, this won't be possible, the rules as it is now. It's like you can rent an apartment and then make an overhaul in your previous, in your own apartment, and in this version, this option is a good option for the ministry. During these 2-3 years, the patients will have medicines, and at the same time, the experts inside Ukraine, and we have in mind particular suggestions, what to change, how to change, what procedures should be in place inside the country to change situation for the better. We may have discussions on how to reform the system, but we should start our work today, because after 3 years, upon 3 years, the international procurement won't be possible for Ukraine anymore. And by this moment, we should have our own system of procurement in place inside the country, oriented towards national system, and let people and allow people to have necessary medicines. Thank you, Dmitry, for good introduction. Dmitry mentioned the situation with the radical reconstruction of the flood. Speaking about the cycle of procurement, so the first stage for public treatment, and that is what Madam Olga mentioned, that is what Dmitry mentioned. We need to have the system of standards in healthcare, standards for treatment. There should be clinical protocols and standards for treatment. Based on that treatment protocols, the list of medicine So the Anti-Monopoly Committee has changed some legal provisions on appeals. Then the Ministry of Health, which contributes to the list of medicines. So all these are problems which we revealed in course of our analysis. So the biggest problem is that the compliance with the treatment standards is not obligatory when the list for procurement is formed. The Ministry of Healthcare order contains the formulation that the list of medicines should be in compliance with protocols, but or should also, the procedure does not set results in a situation when just deregulation is not enough to resolve the problems in this sphere, but moreover, we need additional regulation. Which means the statement, the medicine, this or that medicine, or its equivalent. This absence of its equivalent does not allow to purchase something with some substitutes for the medicine. Also, quite often the tenders have very tough deadlines, which extremely limits the numbers of participants. And this means that smaller companies which did not contain all that 100 products in their portfolio, they were excluded from the list. This slide shows those who could be blamed, they do not bear any responsibility. It's not our function to bring them to responsibility, but we would like to point out that without any responsibility for non-fulfillment of the legislation, no reform is possible. Our objective was to eradicate corruption, to purchase medicines based on the on the standardized medicine, the release of bureaucratic pressure, the liquidation of loopholes in decision making, and involvement of experts to decision making, and we believe this may result in our implementation of association agreement and our commitments in line with it. So one of the primary steps are to pass the protocols, to form the correct list of medicines, more full information about items for procurement, careful study of existent options. Unfortunately, the electronic procurement system does not function properly in the healthcare sector. And also we suggest proper mechanisms how to improve decision-making procedure at the regional, at the local level. There are two ways how this concept could be implemented via acts of legislation We have just some examples of those acts, but we do not believe in this way of the concept of implementation, because it
все-таки создать отдельный закон, который пропишет основные элементы, как должна быть выстроена вот эта вот система формирования предмета закупки. Важным элементом тоже мы предлагаем, чтобы на ежегодной основе
system should be done. Also, we suggest that the Ministry of Healthcare, Ministry of Economy, and maybe the Anti-Monopoly Committee should publish recommendations on public procurement based on annual practice, and this manual, these recommendations would explain to potential tender participants how to submit their bids correctly, and how to prevent any abuse of the tender practice in tender practices. As of today, in many courts, we have an example of such recommendations when Supreme Court annually describes the most spread abuses, offenses, and disseminates it among junior courts. This is how it should be done in procurement. We have prepared very informative document, and we would be happy to receive feedback from the experts. We plan to post this document under the auspice of the Ministry of Healthcare on their website, and this concept will be available for public discussion, for recommendations, for feedback. Then we will develop the draft law, and I believe that finally the changes are possible in this country.
We do know changes are possible, if only under pressure. I see some first reactions from the audience. Vitaliy Gordienko. Yeah, Vitaliy was rather pessimistic in his appraisals. My first comment is that there are no people among us against the need for changes in the health sector. And you know that under the aegis of the Chair and the Association of Normative Medicines, we've supported the Vision 2020, particularly as regards the need for changes in the provision of medicines and supply of medicines. And when we speak about the reform concept, we first of all speak about reform itself or some slight improvements. The question is, a reform is about some thorough top-down changes, and if it is about medicines, it should be from top to the bottom, and slides by Sherembei were a clear indication of that. I think we should need first to come to terms as to whether we're speaking about medicine procurement and supply reform, or this is about the whole change to the system of public procurement, because in the latter case, recommendations should rather focus on itself, on this public procurement system. Because if we check the preamble of the concept, it says about things desirable in as regards changing of relations between suppliers and their clients. Actually, I have many more comments on that. I'm not going to elaborate on all of them. We do understand this has been just the first step, but still our vision is that we need to change the system of public procurement of medicines, not just the system of public procurement itself. And it is about introducing by 2019 a system of reimbursement, not just a system of improvement of the procurement system. Yeah, we do understand that the reimbursement system needs to be in place, and it really merits an individual and separate concept to be developed for that principle, based on facts of life in Ukraine. And because of that, we had our first slide demonstrating our strategic vision of that. Nevertheless, the remaining public procurements that are still remaining in Ukraine until this reimbursement scheme implementation, they will most likely persist at the national and regional level, and they do need improvements nevertheless. Because of that, we mentioned the need to make a reform of medicine procurement. And the reform, or this major refurbishment probably, in the area of medicine procurement will be beneficial for both centralized procurements, those at the regional level, also those done with involvement of international organizations. But it will be after the subject matter of procurement is identified, because only after it is identified the procurement begins. The thing is that sectoral standards and clinical protocols mentioned in the concept relate not just to the state procurement system, but also to the procurement of medicines. So my point is still that whenever I speak about sectoral standards, we need to cover all areas, not just the national state procurement system. I fully support the idea that the whole system needs to be changed, and should be done with a focus on how patients are going to get the medicines from the starting point of the process to the very end. I do not share pessimistic views of the situation. A simple example is that we have the chair of the Public Health Protection Committee of the Verkhovной Rady. Draft legislation on international procurement was elaborated and pre-agreed within just 1 month, which says that it doesn't take a lot of time if there is a strong intention to do it. And we will continue with reforms irrespective of our adversaries. And I'm optimistic not because of the situation in the country, but because of my strong belief in the third sector, in civic activists, and in those officials who are ready to fight for changes for the better, for the whole system, for every and each patient in the country. This is my source of optimism. As the Verkhovna Rada is actively working today, they have a plenary session. I think Olga will need to leave the place rather soon, so please take your time to put questions to her. Actually, in absence of questions, I could tell you that I share optimistic vision of it, and the composition of the Ministry of Public Health Protection, excluding Mr. Pereginets present today. So the current composition of membership in the ministry will hardly see any reforms, because everything they do now, and the only reason of them doing public procurement is for the sake of end beneficiaries. They have no regard of patients or the population. It is about them caring only of the final beneficiary of the money. And if we are unable to change the situation, then I will be the first one to put a question to myself, what I'm doing in this area. The committee I'm the chair of deemed the ministerial performance not satisfactory in the beginning of this summer, but nevertheless we don't see any documents on improving the situation. Motion to the Parliament, to committee sessions, And it appears that there are some stronger points of influence from above, and the ministry is just a mere performer of someone's wishes. So I think that until we have the civic society, until we have organizations of patients and unbiased media outlets, those media outlets that will provide unbiased information, there will be a chance for us to move ahead. But again, until this moment, we are going against the mainstream current, and that's really complicating the matter. So I'd like you to share my optimism in our ability to build our better future by joint efforts. Thank you. I think that even despite a variety of visions of the concept, we still can and will move in one direction. Do we have any questions or comments regarding the concept of medicine procurement system reform? If yes, please use the mic. A rhetorical question from me. We've just heard that the ministry of the leadership of the ministry has never changed. Who we are going to work with Mr. Pereginets alone? That's ridiculous, no? Yeah, surely there can be a negative appraisal of the system and its performance. Indeed, but it may not be the only reason to prevent us from going ahead. We need to find people who are ready to join the reform effort. If there is just one deputy minister ready to do it, let's work with him. If even 70% of the ministerial staff are not for it, it is not to say that we should forget about the idea. We still need orders, we still need instructions, bylaws, etc. developed by the ministry. And with even some people there willing to change the whole system, we need to capitalize on that. If you remember the times of Bogotyryova, it was a black box situation with no known outcome. Now we see doors semi-open and we need to use it. If you allow my horizontal comment, the changes we discuss here are irrelevant to the current leadership and management of the ministry. Sooner or later, the minister will change either in Ukraine or in the UK, and the whole idea of reform should proceed and progress irrespective of who takes the ministerial office. Well, actually I was to hint on the need of focusing not on the ministry but on some civic activists, maybe, or civic groups. There are political processes involved, and many of these are better left to the ministry. We see some threats to the parliamentary coalition today, etc. So let us be realists and let us continue work. Unfortunately, I see some guys, some key persons have already left the meeting, but still there are people who even at the level of technical assessment work on these matters, and for this reason I want to suggest that we should really move ahead, not focusing just on the ministry or the parliamentary committee. We simply need to joint effort. We need to work with Vitaliy to see where we are on the first stage of it, how we have to change the governmental procurement system in public health protection. There is still a bigger portion of the ministerial area of responsibility that concerns outpatient treatment and inpatient treatment, and we do know that people still need to heavily rely on their own financial capacities to buy medicines. And we also need to explain to the public that what we do now, it will not be about the whole of the population. We are going to rather tackle a portion of the problem, about those patients that need medicines guaranteed by the state and they need to receive it from the state. we need to tell people, to explain them that it will not be for just everyone across the board on the first stage. This is to say, we need a strong information and support and information awareness campaign to explain the focus of our first steps, which will be about targeting the patients most in need of governmental assistance with the medicine supply. Well, Vitaliy correctly mentioned the need to change the procurement system, but it is also about certain sectoral standards which are of influence on the public procurement system. Surely if you are going to change this part as well, it will lead to further changes in other areas of the public health sector in the country. And as we cannot merely count on coordinated work of this ministry with other line ministries and other stakeholders, I think we need to develop our own guidelines and deadlines for this reform to overcome the lack of political will. Okay, we have time for two quick questions. Bruce Ditevich, American Chamber of Commerce. Just a disclaimer, it's not from my side, or it is not related to me. Okay, two questions. So we, with the Public Health Protection Committee in the CHAM, work closely together to press the Dmytro Committee to overcome this impossibly harsh tendering conditions, particularly as regards procurement, not just on the national but on the regional scale. It is of paramount importance in the current conditions to do so. And from here, Vitaliy put questions for the far future. And the question is about changes that are implemented or are as if implemented today, right today, because the system is far from being established and created to this moment. So let us forget about the ministry for the second. There are documents that are waiting to be adopted and implemented, and there are changes pending. Do we see any chance of changes already this year? Well, the first question regarding tendering, bidding procedure, tendering documents, gaps in there. We had a whole chapter in our document. We didn't cover it today, but we suggest a whole range of changes suggested. That is pre-qualified selection procedure to facilitate participation in forthcoming tenders with no substantial changes in personal information of the bidder. Then certain formality criteria we also introduced, not to get rid of nice proposals just for the sake of bad numbering in the documents, say. And we are also going to send our concept paper to the Anti-Monopoly Committee to hear their comments and their inputs in the document. Given the practice they've already accumulated, it could be beneficial for us. Regarding the second question, which was about international procurement, if we check the total share of the reform in this area, it was just a small brick in this wall put this year. There was an order dating back to May this year to establish an expert council to work on that, and there are some positive changes. That is, rather than continuing to have 131 qualification commission, we have just one body to do it. Surely it is not enough. My estimate is it's probably a 30th or a 50th part of the totality of changes needed in the area. Let me put it like this. We'll drop the line in December this year. We still have 3 months to go, and we are going on bullet train against concrete wall. And if all international experts and consultants will do what they can there in the ministry, at least we will not repeat the fracas of 2014, and hopefully it will provide us with possibility to avoid these mistakes. As regards international procurement, we've heard of draft contracts already prepared to be signed with 2 agencies. We've never seen the documents, but we've been told so. And we strongly believe that by mid-September the question will be finally resolved and the papers will be signed. There is a safety net for the Ministry of Public Health Protection. It goes like this. If in the end of September the ministry comprehends that they are not capable of following this procurement cycle, will have 2 options. First, to transfer the not contracted procurement amount to international organization. And this is the key option. We discussed the situation with them and they understand it. So we'll have to wait until the end of the month to see how it goes.
I would like to remind you that formation of public procurement is a several years cycle. The question to Dmitry, not all the national laws for international procurement procedure are in place in Ukraine. We have passed only 4 laws out of 11. Also, there should be some changes in technical regulations in funding calculation procedure, etc. We have 3 questions in turn. Dmitry, thank you. Thank you, Lana. You partially answered my question, but the business community has a feeling about international procurement that since May, the process is in place and we are moving towards international procurement, but we cannot imagine the procedures of today. This meeting is not devoted to the international procurement procedure. This is about our concept of procurement. We have disseminated this document. We will do everything possible to translate it into English and to disseminate it among international organizations. Also, we maintain dialogue with the Ministry of Healthcare. We encourage everybody to join this discussion. We expect that the ministry will preserve a proactive position in joint work with this document. The slide which we have shown you, this is the final objective position of our country in international procurement of medicines via clear mechanism and clearly established procedure. I'm a sympathist of the healthcare reform, and my question is about risk management. Lana, I agree with you when you say that everything should be stipulated at the level of law acts, and having experience with secondary legislation when they actually hinder and make obstacles to proper implementation of the parliamentary laws. What do you plan to do at the cabinet of ministers level? My recommendation is that you should concentrate your efforts at the middle level of bureaucrats. We think that discussion, the most important aspects of the reform should be made as public as possible. But if I ask you, do you know what bylaws are currently developed by the Ministry of Healthcare, you probably won't be able to answer. We wish to pass this document with very open procedure and with a calendar plan for its implementation. What is possible today? The tool, the instrument which is pushing towards reform is a civic sector. We participated in developing the healthcare reform. We participate in reform of the public procurement procedure. We understand that patients can die without treatment and medicines. Today's morning, I received a call from parents of those children who now will not receive necessary medicines because the tender for procurement of that medicines against rare diseases is not held, and our main objective is to rescue human lives instead of demonstrating that we are more European or less European. That's why I believe that the civil society sector remains a dominating driving force in the healthcare sector reform. Now, one more question. Evgeny Dolgan, Arterium Corporation. I have one small remark and a question. The remark is as follows. The ministry does not have 3 months to finalize the procurement. They have just 2 weeks because 6 weeks are necessary to conclude the contract, and 1-2 months are needed for the producer to produce medicines. And now my question about transfer of procurement to the international organizations in the WHO organization. They have their own procedure. And whether our Ukrainian producers would be able to join the procurement procedure. The WHO organization is ready to change the procedure to allow Ukrainian producers to participate in it. It's not just, and moreover, it's not just WHO who will organize the tenders for Ukraine. We also involve the British international organization. They offer pre-qualification for our producers, and thus they will get access to another bigger market, because those organizations are open for 110 countries. when this will happen, when they will get access to Ukrainian procurement. Those agencies are waiting for signing a contract with the cabinet. Does it mean that if Ukrainian producer has GMP, this automatically allows them to participate? Now they will need a 3-week qualification procedure. Let us ask final questions and then wrap up. Very short comment. I would allow myself to make this comment. This is a comment on Dmytro. If you put a key factor of reforms on the civic society, I would suggest to improve the coordination between civic societies. While in the healthcare ministry, etc., there is a lot of corruption, but inside the patient organization there is also a lot of corruption, and I would suggest to purify the patient organization from corruption, to make them more patient-oriented, and to carry out some sanitizing procedure around them. We do not have enough time to discuss this topic, but all the NGOs in patient sector, they are subject to PricewaterhouseCoopers audit, and of course there are some pocket patient organizations, but we involve those who work openly, transparently, who have a long story of operations in Ukraine. And now your comment. We also procure the same medicines as the Ministry of Healthcare does. The last year we lost $15 million because of the exchange rate, and our network has covered the needs of first quarter on the account of donor money, and this year we are warned that on September 20th the Global Fund is coming to Ukraine to get from the Ministry of Healthcare the answer how much they plan to increase funding for procurement of medicines, and by the as of the moment, all the medicines necessary for HIV patients I'm here appealing to the patient organizations to use all possible ways. I suggest to start our discussion today to use Igor Pereginets' advice to assess the needs for this year, including the all the existent legislative initiatives, and I encourage you to comment on the concept actively. You have you can take several copies there. We have electronic copies. We will try to convince the ministry to post it on their website. Besides tactical issues, we have strategic issues which should be resolved by this concept. We have tactical issues with the currency exchange rate, with the involvement of international organizations, with procurement for this year, but the issue should be resolved at the strategic level. Thank you for interesting discussion. It attracts a lot of interest, and in some months we will come back to it. One more organizational announcement. This is for mass media representatives. Today we are going